Hi, this is Jessica DeMassa, and I'm at HIC 2017 here at the HISA Studio booth, and I am with Adrian and Julian. Nice to meet you guys. So tell me a little bit about yourself. Introduce yourself for the folks watching.
Yep, so I'm Adrian, amelie.ai. I'm the psychologist in the team, and Julian, you can introduce yourself.
Yeah, hi everyone, I'm Julian, co-founder of amelie.ai and the tech guy.
Okay. So tell me a little bit about amelie.ai. What exactly is this?
Yeah, so supporting people with mental health challenges using a conversational messaging system.
Okay, so what does that mean in English?
So people can essentially use their own natural language to communicate to Amelie what their concerns are in the mental health space, and Amelie can do its job in understanding that and actually matching you with the resources that are relevant to your challenges. Yeah.
Okay, so if I'm feeling depressed, how do I get her? Is this an app or what am I using?
Yeah.
So Amelie is actually available across a bunch of messaging platforms. Facebook is like our most popular channel, so you can connect to Amelie just by searching amelie.ai in Facebook Messenger and start a conversation. It's really simple. It starts off by saying, hey, how are you going? How do we help you? And you just basically say what's on your mind.
And so this is using chatbot technology, right? So tell me a little bit more about that. I'm going to ask the tech guy.
So yeah, chatbots have been around for years. So they started off as a really geeky thing in IRC channels, but essentially they become popular through messaging platforms, started in China with WeChat, but Facebook Messenger is 15,000 bots that are on their platform, so a huge community. But the great thing about it is you can actually deliver a rich messaging experience, so you can actually have more than just conversation. You can deliver links, you can deliver images, you can have buttons for people to quickly answer questions, things like that. So you can just have a really simple experience directly on the Messenger platform, and because it's on Messenger, you can update it whenever. So there's no app to download, nothing to install. You can create new experiences all the time through the platform.
Okay, and so tell me about some of the outcomes, the clinical outcomes from this. Like, does this show that it's working? Like, tell me a little bit about that, the impact on the patient.
Yeah, I mean, that's where we want to get to. We're quite early at the moment. Really, in the last year, we've been testing out different capabilities that are needed. So, as an example, we've still got issues in mental health where lots of people are not getting the level of accessibility that's needed. And as a result, this technology that can be available around the clock is hopefully going to address that missed contact volume that we're seeing. Where that contact's initiated and our technology can actually work to triage and escalate high risks through to service providers, then we're hoping that level of accessibility is going to not only address the missed call volumes, but also hopefully bring down the levels of mental health challenges and even suicide if people can actually get around the clock support.
How does a clinician integrate this in? Like, what's the ideal way for a doctor, a mental health professional, or even like a primary care doctor to say, hey, you're feeling blue, you should check out amelie.ai. How do they do that? What's the best way for them to integrate it in?
Yeah. Do you want to handle this, Techie? Or?
Yeah. So the easiest way is to we're talking to a lot of telehealth providers that are starting to go full digital. So basically, instead of going in making an appointment, it's just go directly through this telehealth channel. So really, what we provide them is a way to either offer a service post the appointment, so to sort of check in afterwards and follow people's progress, but also to allow people to actually book directly through the platform. So, again, it's very simple to say, where are you? You can drop a pin in Facebook and give you a location. You can say, when do you want to get an appointment? So similar to the various booking, ZocDoc, etc., we can provide that experience through the messaging platform. So facilitate the booking and also the check-in post appointment.
So I want to ask you a little bit about the startup community here in healthcare in Australia, because I know it's kind of burgeoning, right? So it seems like it's just really starting out. So tell me your experience so far. I know you won the hackathon last year here. Tell me a little bit about your experience. Where are you guys at from a startup standpoint? Are you an angel? Where are you at?
Yeah. Do you want to start off?
Yeah, so I guess, we're still early bootstrapping at the moment. We're definitely in conversation with a bunch of angels in Melbourne where we're based. There are incubators around, and there's definitely sort of health tech ones that are focused on probably more on the medical side of it. Mental health's a challenging area because it's typically funded by not-for-profits and social venture type funding. And so, we're exploring all those avenues, but it's not a huge community, so we're open to working with anyone early, who really believes in this vision. And there's definitely a lot of passion, particularly in the tech community, with mental health being a big issue. Obviously, founders dealing with a lot of anxiety and stress, right? So we actually get a very receptive audience when we talk about this.
Fantastic. And like, what can be improved, I guess, from your perspective as as a young startup here in Australia in digital health, which is such a hard space to be in already. It's not like some of the sexier technology companies that are startups. So what could be done to support you better? What would you ask for from the greater healthcare community?
Yeah, I think for me it's just a real openness to collaborate and really support different businesses in getting a leg up. Us, for instance, like we're not professing to be able to solve everything, and as a result, we want to be able to connect in where it's advantageous. And so more openness to collaborate. What we see is a real risk aversion and quite a competitive landscape, and I don't think that's actually going to help early stage startups to really accelerate and prosper.
So hopefully things become a little bit more, I guess, interoperable, right, between the healthcare startup community and the established healthcare system, so that things like amelie.ai can take hold a little bit faster and maybe get some pilots going, things like that, get some funding. Fantastic. Well, thank you guys so much for joining me and for speaking with us today here in the HISA studio here at HIC 2017. Thank you.